Today, we're diving into a topic that's crucial in the healthcare industry: clinical quality performance measurement. Specifically, we'll explore an interesting study conducted in a university hospital in Turkey.
That's right. The study used 9 different performance measurement sets, aiming to evaluate whether the care patients receive is aligned with the care they should be receiving, according to established standards.
So, the research took place between January and August of 2012, right? And they looked at conditions like heart attacks, pneumonia, stroke care, and even psychiatric care for inpatients.
Exactly. One of the main findings was that the hospital's overall performance compatibility with these standards was 55.33%. But not all sets showed the same results. Some performed well, while others, like the pneumonia care set, had some issues.
That's interesting. The pneumonia set, in particular, didn't align well with Turkish conditions. They even had to create a new version that better suited local healthcare needs. It was all about adjusting these global standards to the realities on the ground.
Yeah, the research also found that some of the performance sets were spot on, especially the heart attack care set. It had an impressive 97.9% compliance rate, very close to the Joint Commission's benchmarks.
It's fascinating how these international standards, like those from the Joint Commission, can be adapted for use in different countries. But, of course, local factors matter. For instance, the stroke care set had the lowest compliance, only 20.08%. That really stands out.
It does. But it also opens the door for improvement, right? The study suggests that packages like surgical care, heart attack, and venous thromboembolism are ideal for Turkey, while others, like pneumonia care, need tweaking.
Absolutely. It's all about optimizing care. The research concludes that using these performance measures widely could play a huge role in improving the quality of healthcare in Turkey, especially in terms of reducing errors and enhancing patient outcomes.
I think it's also worth mentioning the importance of accountability in this. The Joint Commission's accountability measures seem to be a good fit for improving healthcare quality. It's not just about meeting a standard, but also about creating a culture of responsibility within healthcare institutions.
Definitely. And while the study focused on a university hospital, the implications go beyond just one institution. The goal is to build a more reliable healthcare system, where quality performance is the norm, not the exception.
Right. The broader impact could be immense. I'm curious, though, how do you think hospitals in other parts of the world can apply this model? Do you think these measurement sets could work in every country?
Good question. I think the key is flexibility. Standards can be universal, but they need to be adaptable. What works in one healthcare system may need modifications in another. The real challenge is finding that balance between global standards and local realities.
Well said. And in the end, if these measurements improve patient outcomes and save lives, then it's definitely worth the effort to tailor them to local conditions.
Couldn't agree more. This study serves as a reminder that healthcare quality is an ongoing process of improvement and adaptation. So, what's next? Are we going to see these measures implemented more widely in Turkey?
I hope so. If anything, the study shows there's room for growth, and it provides a solid foundation for healthcare institutions to build on. Let's keep an eye on how this evolves. Thanks for the great conversation today.
Absolutely, always a pleasure. Let's catch up again soon on how these measures are making an impact.
End of episode.